I want to shift our focus back over to the coronavirus front as we've been spotlighting that over the last few days. Of course, cases continue to rise there, but hospitalizations across the nation have risen for the last 30 straight days. It's a nonstop battle that's intensifying for America's frontline workers, already stretched and fatigued from a year of battling the pandemic. And for more on that, I want to bring on our next guest here. Frank McGillen is the Amwell and Cleveland Clinic digital health company CEO. He joins us now alongside Yahoo Finance's Anjali Kamlani. And Frank, I appreciate you coming on here to chat. And you can speak to the stresses being felt by frontline workers probably better than any guest we're going to have on today. You guys announced earlier that your own resources are getting stretched, seeing about 1,000 workers contracting COVID-19 and battling all this. So when you look at that and extrapolate it to clinics across the country, how stretched do you think that some of these systems are going to get?
Well, first off, thanks for having me today. And I think, to all the frontline workers, our support's there and our hearts are out to them because I think they really are making such a huge difference. But in general, coronavirus has really pointed out the fact that, we need to think differently about healthcare and really how do we unlock the best care globally. And, one of the mission that we have at the Amwell, Cleveland Clinic Amwell joint venture is how do we apply technology to make sure we can make that best-in-class clinical expertise available where and when you need it.
Frank, looking at the context of what we've seen with what the pandemic has done for the health industry. So let's put this in context. We've seen companies like Amwell, we've seen companies like Teladoc, and we've seen companies like GoodRx really push forward, not only with public fundraising, but also just generally growing operations. And we've seen companies that have nothing to do with it, that are just video platforms, really taking on a more significant role in this outbreak. What does that mean for future? Because, when this joint venture was formed, it was really when telehealth was still just a conversation. And now that there's been so much application, I just wonder, has anything changed in the outlook for the company?
Yeah, I think it's fair to say the genie's out of the bottle. We always start with really that patient approach and think about the person who's dealing with a complex medical condition, whether it's COVID-19, whether it's a cancer diagnosis or serious heart condition. How do you make it easy to get the best care? How do you make sure that they're getting the right information at the right time to guide them to make the best decisions? And, I think the evidence is out that telehealth is really helping empower that. The feedback from patients is that they like the experience, and particularly now when you're trying to really minimize exposure, the ability to get access to a world-class expert through telehealth technology is really a motivating thing. But I think the overall convenience factor, we're going to get beyond this. But I think the convenience factor and the ability to access the best care will continue to be something that patients and consumers are looking for and demanding. And the feedback we're getting from clinicians is they like the way it helps them expand their reach.
So no question, Frank, you point to the convenience and the comfort level that patients have experienced now that they've had to dip their toe into telehealth. How much of that shift do you think is actually permanent, though?
Well, I think, again, you think about people's busy lives and trying to really deal with multiple aspects of their life and not just the fact that they may be dealing with a health condition. So I think that will continue. Now, there's some care that really needs to be face-to-face. And, if you need surgery, you need surgery. But if you think of that follow-up visit after you've had a heart treatment or after spinal surgery, many of those follow-up visits can be done adequately just as well through telehealth. And when you then add on remote patient monitoring technologies, in some cases you can actually, because you can measure and track people day to day, 24/7, you can monitor them and help anticipate and better, reduce any complications that they might encounter.
Frank, Amwell has done a really good job of sort of staying behind the scenes and being part of the administration of any health system that they support. But why move forward with this joint venture, with a brand per se? And what are the implications then moving forward for the company?
Yeah, no, if you look at Amwell's history, they really have been innovators in terms of bringing the best technology and making telehealth easy, effective, and available to a broader population, partnering with many health systems. What partnering with the Cleveland Clinic has done, and what our mission at this joint venture, Cleveland Clinic Amwell joint venture, is really unlocking the best care. And by integrating both the technology platform with the workflows of the physician, thinking about that patient experience, we're able to deliver really incredible value to the patient. Our initial focus is on the second opinion market and thinking about someone who's gotten a diagnosis of, say, cancer, heart disease, a neurological problem. And if you put yourself in that patient's mindset and you're saying, I got this serious diagnosis, I really need help to navigate. I'm really looking for the best information. And what we've been able to do by this partnership is make that expertise available. Cleveland Clinic's #1 in cardiology for over 20 years. The #2 rated hospital system globally. And now with telehealth technology, we can make that expertise available whether you're in Cleveland or whether you're in Kuala Lumpur.
Frank, there's an argument to be made that even pre-coronavirus, this push for more remote health is what led to sort of reduced staffing in some of these hospitals. And there was a concern in the initial days of the pandemic. That's what led to the staffing strains that occurred. How do you think hospitals balance these two areas moving forward?
Yeah, well, balancing demand and supply and demand on the provider standpoint is actually a really powerful tool for telehealth. And if you look at the telestroke business, for example, or a telestroke platform, for example, regional medical systems that may not have a staff neurologist who's a stroke expert on staff or limited hours, using telestroke technology, be able to deliver that care to that patient in those critical hours when the right intervention is so important. We're partnering with a health system in Indiana to help provide expertise in the emergency department in terms of dealing with complex COVID-19 cases. And if you think about the right decisions at the right time can really affect the outcome for those patients. So we see it as really helping make, not only from a patient standpoint, but if you're a health system, is making sure that you can tap into the right expertise and deliver that care.
Yeah, and freeing up those resources, freeing up staff, all obviously more important here as we talk about the strains on the current healthcare system. But Frank McGillen, CEO of the Amwell Cleveland Health Clinic digital health company, that joint venture, appreciate you taking the time to chat with us today. And our thanks to you, Yahoo Finance.
Thank you. It was great joining you.
Thank you. Be well.